Radiculopathy versus neuropathy. You're watching a production of GoodHealthTube.com. Later in this video, we will discuss an important enzymatic discovery that has profound and potentially life-changing implications if you suffer from peripheral neuropathy. When discussing radiculopathy and neuropathy, it is important to be clear in the definition. The term neuropathy is generally referring to peripheral neuropathy when spoken by both medical personnel and laymen. So it would be more accurate to title this video, Radiculopathy versus Peripheral Neuropathy, to avoid any confusion. Peripheral neuropathy is disease or damage to the nerves in the body that are outside the brain and spinal cord. Radiculopathy is damage to nerves that come out of the spinal column due to pressure on these nerves as they are coming out of the spinal column. Even though these nerves are just coming out of the spinal column, they are considered peripheral. So it is technically accurate to say that radiculopathy is a subset of peripheral neuropathy. Radiculopathy is a kind of peripheral neuropathy that occurs to a nerve or group of nerves from abnormal pressure to the nerves, usually from a structural defect in the spinal column. The spinal column consists of the bones that make up the spine. These bones are known as vertebrae. There are also several ligaments that make up the spinal column. Finally, there are also discs made up of cartilage that cushion the vertebral bodies as they move. The causes of pressure to these nerves can involve several disease processes such as herniated or bulging disc that press against the nerve. Arthritic changes to the vertebral bones can also push against these nerves. These arthritic changes cause a narrowing of the space where the nerves exit the spinal column. Peripheral neuropathy, not including radiculopathy, is often caused by metabolic conditions such as diabetes. In diabetes, elevated blood sugars are directly toxic to the small blood vessels supplying blood to the nerves, thus causing damage to the nerves. Other causes of peripheral neuropathy include inflammation from autoimmune disease, circulatory problems, vitamin deficiencies, kidney disease, and side effects from other drugs. You can learn more about the causes of peripheral neuropathy from our video entitled Peripheral Neuropathy Causes, which you can find in our neuropathy playlist. A link will be in the video description. So while radiculopathy is technically a subset of peripheral neuropathy, radiculopathy is specifically dealing with compressive injury to nerves as they come out of the spine. Both disease processes can cause pain and muscle weakness. Radiculopathy is typically associated with back or neck pain depending on where the pinched, compressed nerve is located, but it can be difficult sometimes to tell the difference. The diagnosis of radiculopathy will require a visit to a doctor, a physical exam, and usually some kind of imaging study of the spine such as a CT scan or MRI. A peripheral, non-radiculopathy, neuropathy will also require a doctor's visit as well as blood test and other tests such as nerve conduction studies. Neuropathy will often involve seeing a neurologist whereas radiculopathy will often involve seeing a spinal surgeon. Not all radiculopathy will require surgery. It can often be managed with pain medication and physical therapy. The pain medication involved may be the same as those to treat peripheral neuropathy. If you have peripheral neuropathy that is not radiculopathy in nature, we encourage you to look at our blog post on peripheral neuropathy, a link of which is in the top of the video description. We actually believe that our post is the best on the internet for the non-medical person who is interested in the topic of peripheral neuropathy. You'll also find a link to an important and profound discovery regarding an enzymatic process involved in peripheral neuropathy that has important implication in pain relief. This can be life-changing if you suffer from peripheral neuropathy that is not radicular in nature. We hope you have enjoyed watching this video as we believe that knowledge is power, particularly when it comes to your health. We also believe in harnessing the power of mainstream medicine as well as alternatives that are beyond big pharma. Please like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our neuropathy playlist. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.